Hey everybody, Dr. Leo Krawetz, Healthy Feet Podiatry. Look what I got behind me. Lots of love. Lots of love in the air right now. And we know that you love ingrown nails. So we're gonna show you another ingrown nail. Come on. Walk this way. Oh, Dr. Cruz.
Oh, hello. Oh.
It's the famous Dr. Cruz.
Hello, everybody.
It's Dr. Taro.
How you doing? I made it. I'm not fired.
John. That's
Yeah.
I changed your number. That's
Look
what
at
I
this,
was on. Over there. Long walk down the hallway. Okay, we're coming in the room. The patient doesn't want to be on video. We got the video going right now. We're going to show her toe. And this patient has an ingrown nail. And she's a huge Dr. Pimple Popper watcher. She told me. And she said she wanted to be filmed. So we're going to film her toe. What's unique about this toe? Nothing. She had an ingrown nail before. Nothing out of the ordinary. She said she saw pus coming from the toe, right?
I did, yeah.
Last week?
Last week, I tried to dig it out myself and there was pus.
She tried cutting it out herself. You can see a little bit of bathroom surgery right there. A little bit of old bleeding. Didn't work. And now she's here. She had the same procedure done on the other toe, how many years ago? 3 or 4?
Like 5.
5 years ago. Let's see what it looks like. Looks pretty good, actually. So we're going to do this one. Nothing really significant about it. Maybe we'll get lucky and see pus. It'll be like pimple popping. So it'll be almost like having Dr. Pimple Popper show in front of you, but with your toe. So let's see. So I numbed her up. I gave her a shot here and here, local anesthetic, just like we always do. I'm going to wrap her up right now because she's nice and numb. Do you feel that?
No.
Okay, good.
It's
So let's wrap it up.
Is that okay?
Yeah, so we're going to exsanguinate the toe. Yeah, tingly's normal. Tingly's normal, and if you want me to put your head back, let me know. Okay. So, and you can actually watch the procedure on that. See how close up it is? That's why it's so cool. So this patient asked me, is this really cool to watch on YouTube? And I said, it's really cool to watch because it's up close and you can really see the details. And it is pretty amazing when you see this stuff up close. So we're gonna have fun with this and see what we got here. And we're also gonna get rid of our ingrown nail.
Yes.
So what I did was push all the blood out of the toe, or a lot of the blood. It's not all the blood, but a lot of it so it doesn't bleed. We want that dry field so it doesn't, so the chemical will take, because the drier it is, the less blood will mix with the chemical, and then there's a better chance that the chemical will kill the nail matrix where the nail grows from. So here we go. We're gonna free up the nail right now. Does that hurt?
No.
Okay. Let's see. If we're gonna get pus, this is when we're gonna get it right now. So let's see. Do we have any pus? Nothing.
Nope.
Oh, what a letdown. All right, maybe the removal of the nail will be more exciting. So there's a little bit of bleeding there. We freed up the edge of the nail, and cosmetically, we're gonna try to make this look pretty good. But because you did bathroom surgery, there's a little chunk of the nail missing. Did you cut the tip of that nail off?
Yeah,
Is
doesn't
that
it
what
look
you
good?
did? It's pretty good for bathroom surgery. I'd give it about a B.
Hey, a bee is
A
passing.
B is good because there's a little, it looks like someone nipped it. It looked like you took a nip out of it that maybe, if I didn't know any better, that you tried to reach down there and bite the end of that nail off
No,
yourself.
I
To try to
used
do
be
it,
that
but-
flexible.
Okay. Not anymore. Okay. All right. No, but it looked like a little chunk was taken out of there. And it wasn't real smooth at the end. And you can see, this is what I'm talking about. You see that spot? See that little chunk right there? Right in that area, but that's okay. So let's get this out right here because we're going to clean that up in a second too. So this is the great part. This is the part that everyone likes to see. Do you feel something?
I don't know if I do. If
Okay.
it's just my mind.
On Dr. Pimple Popper, everyone likes to see the pus coming out. For us, everyone likes to see the ingrown nail come out. So what we do is we clamp on. Well, let me get a better clamp of this. We clamp onto this nail. Oh no, hold on here. We got to get under it. But this is going to be anticlimactic, possibly. Where's my nail? Do you feel anything there?
It feels a little stingy.
Hold on here. Let me get this back here because I think we pushed that in. Where is my piece of nail? It's right here. Nope, hold on. Let me get a bigger piece here. Let's start here. We're going to get a little bit more. You okay up there?
Okay.
Okay. We're going to get the straight piece here, so it actually is even with this other one. Now you can see where I...
Pain or pressure?
It's all about
Pain?
stingy, but I'm fine. Like,
Okay. Now we're gonna grab onto this piece right here. So this is the part that everyone likes when the nail comes out. Is that hurting?
It's stinging, but it's fine.
Okay.
Like it's not.
Let's see what comes out. And it came out in pieces. This is not overly exciting. There it is, a little baby piece.
Yeah.
I'm actually disappointed. And I'm not really satisfied with this piece, but usually we get a big chunk out of there. So you did get a lot of that nail out of there, it looks like, when you took it out. But we're gonna clean some more. We're gonna see if we can find more stuff. This is small, but this is the edge right here that was sitting in there. It's not overly significant. I'm guessing that you probably when you cut the edge over here off, you didn't leave me anything. But that's okay. I'm gonna clean this stuff out right here where you can see where I'm pointing with the nail. So we have this little piece. Not real crazy to look at, but let's see what's left. Now we're gonna go exploring, and we're gonna look under here, and this is what I'm gonna do is grab right here and see if there's anything more in here that we can get out. Is this freaking you out at all up there?
No.
Okay. So we can either pull it with a hemostat or we can use a tissue nipper. And I'm gonna pull a little bit of this. See this callus skin right there? Again, another little piece, but we're making this edge real clean. And I'm gonna take anything that's left in there, and I'm gonna feel with this to make sure we didn't jam anything in there, but I don't think I did. I think just I was digging for stuff that really didn't exist there because the patient got it out herself. So instead of a B, I'm gonna raise you to an A-.
Yes.
There we
So you
go.
actually got some of that stuff out of it. So your grade goes up because you did get most of the nail out. This is a tissue nipper right here. Flat end of the tissue nipper goes in here, and what we're gonna do is explore with this. And I'm really gonna get these jagged edges of skin off of here and clean it up. And I'm gonna feel in here to see, and I don't feel anything in here too. That's good. The other way that I can check this out to make sure, because again, I wasn't overly satisfied with that piece of nail. When I put the chemical in here, I'm gonna feel with the end of the cotton tipped applicator. I've got the chemical on the end right here, and I'm gonna feel with this. And this should be really smooth, and I should not feel anything. The other great thing with these cotton tipped applicators is when I twist these around, if there is any debris there, it actually forces it out. Because the cotton, it'll kind of grab onto it and it kind of sticks to it and nothing's coming out. You can see a little bit of skin right there, but this is, there's a little piece right there I'll just have to nip off of there. But that's just skin there. So this is actually really good. It's really smooth. Our patient actually did a really good job getting this out herself. The only thing is she didn't have the chemical at home, so she couldn't do the procedure. Now we're gonna leave that there. And it's not for good, but I wanna get this piece out here because it's driving me crazy watching it on the screen and watching it in front of me as I put this chemical here. We're gonna make that real clean. So we've got one stick, we're gonna do 2 more. We do these for about 10 seconds each. This kills the chemical, so this kills the nail matrix, so it won't grow back. And again, all by feel. When I feel this, I do not feel any nail in here. Can you see that up there? Are you able to see it? Okay. Not freaking out yet, right? Is it hurting?
No.
No pain?
No.
No burning, anything? Okay, good. So what's more exciting, this or Dr. Pimple Popper? You can be honest.
Dr. Pimple Popper.
The pimple popping is kind of cooler than this.
I know. I guess I took.
That's
I'm gonna have
surgery.
you go, when you watch this video, I'm gonna have you watch your video, then go back and look at some of these other ingrowns
Yeah.
and see how satisfying it
I'm
is.
sure it is.
But it is kind of cool to see a bunch of stuff spewing from a foot. And we do have some ganglion cysts where we do the same thing. And the stuff spews out of it, it's kind of gross. I know that stuff
or
kind of
like the
grosses
dead
it out,
skin
but
that you shave off of people's
and
teeth.
yeah, that stuff too.
Go
yeah,
check out the
Quarantine
nail cutting
dialysis,
video.
Yeah, the nail cutting stuff is cool too. Oh yeah, some of the nail cutting.
That one
videos
nail
are
one we have is
pretty
intense.
insane. Pretty insane. So, all right, let's go ahead and we're gonna put some of this in here. And this is our vinegar. Yes, we're not gonna make the same mistake that Dr. Cruz almost made and put sodium hydroxide in there with the dropper, but I think someone left that on there by accident. And he almost put sodium hydroxide into someone's nail. That's it. We're gonna just put a little bit of this triple antibiotic cream on here. And that's it. So we put the triple antibiotic cream on there. That's all done. I'm sort of sad. I didn't get to see anything really cool, and I didn't get a big chunk of nail. But I'm happy for the patient because she's not gonna have an ingrown nail anymore, which is great. So we're gonna wrap her up just like we always do. Nothing really fun to say. Maybe for you it's fun. If you want to see that, you can see it on another video. Otherwise, subscribe to the channel if you like what you see. The next ingrown nail, I want to promise you that it's going to be much cooler. But if you're not satisfied with this one, go back and look at some of our old ones. We've got some great ones. Or watch what follows this video. We'll see you later. Thanks.